محاضرتين راح يكونوا اسهل من المحاضرات الديسليبيديميا وحتى الكونكتيف تيشو ديزيز. اول محاضره اللي هي البهجت ديزيز والفاميليال ميديترينيان فيبر. طبعا البهجت ديزيز طبعا هو ليه سموه بهجت، اللي اول واحد اكتشفوا او لاحظوا اللي هو ديرماتولوجيست، تيركش ديرماتولوجيست، فكان هذا الدكتور التركي اسمه بهجت، فعشان هيك سموه بهجت ديزيز. Anyhow, so Behcet disease is a rare vasculitic disorder. So the pathophysiology إنه some type of vasculitis. It's characterized by triple symptom complex of recurrent. طبعا الكرايتيريا أسهل من الكونكتيف تيشو ديزيز، هم ثلاث oral أو مش ثلاث بس، اللي هو الكاركترستيك تبعته اللي هو triple symptom complex: oral aphthous ulcers, genital ulcers ويوفيتس. طبعا الثيوريز behind الباثوجينيسيس وبهجت disease currently suggest an autoimmune etiology. وفي ناس بيحكوا لك exposure to infection، يعني كلها theories ولا في شيء to prove it. But the main thing it's a kind of vasculitis. البهجت disease is a sporadic disease, but familial aggregation is well known. Carriers of HLA-B51 will HLA-B5 have an increased risk of developing Behcet disease. So remember that اللي هو connection مع HLA-B51 وال HLA-B5. وهذول بيكون في عندهم increased risk of Behcet disease. The prevalence of Behcet disease is highest in Middle Eastern, يعني it's common in our area, and compared to other countries. So it's not that common, but compared to other areas of the world, it's more common in Middle East. The sex prevalence varies by country. In the Middle East, Behcet disease is more common among males, with male to female ratio of 3.8 to 1, and تقريبا 4 times the males affected compared to the males. The SLE was more common with females. The rheumatoid arthritis more common with females, but the Behcet disease is more common with males. The males are more likely to develop severe presentation of Behcet disease. يعني حتى لما بيصير شو اسمه البهجت disease عند males, they are more likely to develop severe disease. طبعا أكثر شيء إحنا بنخاف منه إنه the blindness because of the uveitis that the patient might develop. Pulmonary aneurysms, eye involvement, thrombophlebitis, and neurologic disease are all more common in males. اللي هي serious complications of Behcet disease. However, females are more likely to develop erythema nodosum like skin lesions. Behcet disease is most common in persons aged 20 to 40 years. يعني Behcet disease affects young people. Excuse me. عدل قاعد كرسي. The mean age at onset is 25 to 30, so it affects the young people. In cases that develop before the age of 25 years are more likely to involve the eye disease and active clinical disease. Typical presentation, multi-organ system involvement often begin with mucocutaneous involvement. يعني هاي الديزيزز مش زي مثلا واحد صار عنده tonsillitis، هاي اللي إلها autoimmune etiology. يعني these diseases affect multi-systems. زي ما حكيت لكم المرة الماضية for example باللوبس، زي for example rheumatoid arthritis، which is connective tissue disease اللي بتذكروا المحاضرة. حتى البهجت disease. It's not related to a single system disorder. زي واحد مثلا بده يصير عنده coronary artery disease من اسمها coronary artery disease. So the patient will develop coronary arteries. هذول لا بيكون في involvement ل more than one system. That's why you need to have high clinical suspicion when you see these patients. فبيجي لك بيقول لك والله عندي دائما بيطلع لي حمو ثمي. أنت على طول يعني الحمو ممكن يكون هيربيس، ممكن يكون شو اسمه بهجت ديزيز. فالكلو انه المريض بيقول لك والله انه ريكرنت. الريكرنس طبعا الهيربس بيكونش ريكرنس، يعني ممكن يصير له مره كل 10 15 سنه، لها علاقه بال upper respiratory infection ولا something like that. فبس البهجت ديزيز بيكون ريكرنت، بيقول لك والله يا دكتور كل شهرين ثلاث بصير عندي حموض ثمي حموض ثمي. At that time you start thinking about Behcet disease and you ask him more questions related للبهجت disease. بس مش كل واحد بيجي عليك والله طالع له حموض ثمي معناته Behcet disease. So the typical presentation is a multi-system involvement, often beginning with a mucocutaneous involvement and usually sparing the liver, kidneys, and heart. The age من 25 to 35 years old at onset. The organ-specific manifestations characterized by exacerbations and relapsing remitting course. زي أي autoimmune disease. بصير في عنده إيش recurrent painful genital ulcers that heal with scarring. So this is a very important. You know, ulcers are painful and they heal with scarring. And these ulcers are recurrent. ممكن تصير في عنده ophthalmic lesions including anterior or posterior uveitis, hypopyon or retinal vasculitis. طبعا this is the most, in my opinion, the most feared complications للبهجت disease إنه the patient end blind. With skin lesions including erythema nodosum like lesions, pseudofolliculitis or papulopustural or acneiform lesions. يعني بصير في عنده more than يعني ال skin involvement can be of any kind of skin lesion. زي erythema nodosum, therefore erythema nodosum really affecting lower extremities, or painful indurated red lesions, pseudofolliculitis, papulopustular or acneiform lesions زي الacne. Positive results from Pathergy skin testing اللي هو formation of sterile erythematous papule 2 millimeters in diameter or larger that appears 48 hours following a skin prick with a sharp sterile needle. So remember that. We'll talk about it in more details. هذا الأفس ulcers. الكاركترستيك تبعت الأفس ulcers often more than 5 times per year أكثر من 5 مرات بالسنة. And appear as multiple lesions or groups. شايفين يعني كل لسانه معبى أفس ulcers. At a given time, often more than 6 simultaneous lesions at a given time. Skin lesions often occur in the genital region of both sexes. Ocular lesions, ocular presentation, anterior or posterior uveitis, hypopyon, retinal vasculitis, cystoid macular degeneration. طبعا شلون بيجيك المريض؟ يعني هاي الدايجنوستس تبع الديرماتولوجيست الاوفثالمولوجيست، بدك تستلم بعد هو الاكزامن البيشنت، بس بيجيك بقول لك عندي فوتوفوبيا، عندي blurry vision، عندي eye pain، ocular pain. this is when you start thinking about Behcet disease. انت الاكزامينيشن تبعك ممكن تشوف لك شويه conjunctival injection ولا شويه redness، but when you do more thorough examination بتلاقي عنده اللي هو inflammation. So ocular presentation represent the first manifestation of disease in about 10% of patients with Behcet disease, but usually occur following oral ulceration. يعني more than 90%، 10% بس بصير البرزنتيشن تبعهم اللي هو 10%. The symptoms commonly include blurry vision, periorbital pain, photophobia, scleral injection يعني بيكون في عندهم حمار بعينه, and excessive lacrimation. Highly recurrent posterior uveitis can lead to blindness. So this is a very important scary manifestation of Behcet disease. In neurological manifestations, neurologic symptoms tend to be an unusual late manifestation 1 to 8 years after disease onset. Memory tends to be affected in most cases, particularly affecting recall and learning. So لو جاك سؤال يعني most common memory involvement للبهجت disease اللي هو learning will شو اسمه recall. Orientation, arithmetic, and language are often unaffected. The symptoms are usually parenchymal in nature, predominantly with brainstem involvement. Behavioral changes, primarily apathy or disinhibition, occur in about 54%. Seizure and bulbar signs with ophthalmoplegia are less common. Other less common findings include infarction due to vasculitis. Anyhow, demyelination, meningoencephalitis, كلها هي less common. فأكثر شيء اللي هو بصير في عنده اللي هو الريكول والlearning. So أكثر شيء affecting اللي هو الميموري. Vasculopathy, Behcet disease can cause aneurysms, more vasculitis in the pulmonary arterial tree that often prove to be fatal. Pulmonary artery aneurysmal involvement is associated with right-sided cardiac thrombosis and can manifest as hemoptysis, cough, chest pain, or dyspnea. ليش هو pulmonary artery aneurysm يعني associated with right-sided heart failure, cardiac thrombosis؟ ما هو بصير في عندك aneurysm صاحب pulmonary artery فبصير في عندك dilatation، فبصير كله كأنه chamber. فلما يصير في عندك dilatation I mean pulmonary artery والheart كله بصير كأنه chamber واحد، بصير dilated، بصير في stasis للبلد. لأنه تخيل مثلا حجم القلب، خلينا نحكي والله حجمه مثلا شو اسمه لسه 20 سي سي، لما يصير dilatation بده يصير 40 مع pulmonary artery، فبصير في عندك stasis يعني البريشر بيقل. لما يقل البريشر بصير في عندك ثرومبوسيس. ف اتس يعني البلمونري ارتري انيوريزم اللي هو the serious manifestation of Behcet disease. ممكن كمان يصير في عندهم arthritis and arthralgia occurring as many as 60% of patients and primarily affect the lower extremities, especially knee, ankles, wrists, and elbows, can also primarily be involved. ممكن يصير في عندهم renal manifestations in about 1 to 29%. يصير في عندهم amyloidosis may develop. The first presentation is often nephritic range proteinuria found incidentally, crysenteric and proliferative glomerulonephritis, as well as IgA nephritis. So these are the types of Behcet disease nephropathies. The cardiac manifestations, coronary avasculitis, ممكن يصير في عندهم thrombosis, pericarditis, myocarditis, endocarditis. All of these might present or might be presentation of Behcet disease. وفي عندك شيء بسموه الباثرجي سكين تيست. شو الباثرجي سكين تيست؟ بتغزه براس ابري يعني وانديو بتغز السكين يعني مثلا على شو اسمه الفور ارم الفليكسر سيرفيس تبع الفور ارم وبتغزه هناك وبعدين يويت فور 24 hours بشوف في صار في عندك زي اللي هو sterile inflammation papule more than 2 millimeters. So this is positive Behcet skin test and it's one of the criteria for the diagnosis of Behcet disease. So issue Behcet skin test, a sterile blunt needle is inserted into the skin of the forearm. مش inserted يعني انه بتغزها بس يعني ما هو اسمه البيربريك تيست يعني بس هيك غزه بسيطه يعني that's it. The development of an inflammatory papule or pustule within 24 to 48 hours constitutes a positive result. This finding reflects an overactive immune response to minor injuries. Histologic studies of these lesions reveals mononuclear cell inflammation compared to a non-caseating process تبع TB. You remember, guys. But this patient will develop mononuclear cell infiltrates and keratinocytes. The Pathergy test is helpful but is not sensitive or specific for the diagnosis of Behcet disease. Positive results can طبعا هي one of the criteria مش انه يعني انه والله خلص كل واحد عنده Behcet skin test معناته عنده Behcet disease, but it's one of the criteria of Behcet disease. Positive results tend to be more common بالميديترينيان patients اللي هو احنا. Histologic findings, non-specific histologic findings characterize Behcet disease. طبعا biopsy samples of affected tissue often reveal widespread vasculitis of the arteries and veins of any size. يصير في عنده thrombosis commonly develops in affected areas and must be distinguished from vasculitis as a precipitating cause for organ-specific symptoms. اللابس بتلاقي عنده هاي اس ار سي ار بي، ما فيش اي شيء يعني يجوز لابوراتوري وايز اي شيء سبيسيفيك للبهجت ديزيز except اللي هو الباثولوجي سكين تيست if you consider this a laboratory test. الانكا might be positive. هاي diagnostic criteria للبهجت disease. So remember this is the most important slide بكل المحاضرة، اللي هو في عندك major criteria وفي عندك minors. الميجر كرايتيريا مش كرايتيريا، ميجر كرايتيريا اللي هو واحد كرايتيريا بده يكون في عنده recurrent oral ulceration. This is mandatory. اللي حكينا الكاركترستكس تبعتها اللي هي افثس idiopathic ulceration، يعني مش والله واحد عنده هيربس you consider this كرايتيريا البهجة ديزيز، ولا واحد شرب شاي حامي وحرك ثمه معناته صار عنده بهجة ديزيز. فلازم تكون idiopathic observed by the physician or patient، يعني المريض بقول لك عنها with at least 3 episodes in any 12 months period. لازم يكون في عنده 3 أكثر in 12 months، وطبعا painful زي ما حكينا. plus 2 of the minor criteria. So 1 major criterion and 2 minor criteria اللي هي يعملها recurrent genital ulcer by the physician or the patient، أو eye lesions أو سكين ليجنز زي ايش؟ زي اريثيما نودوزا. ونشوف كمان اريثيما نودوزا بنشوفوها مثلا زي واحد عنده sarcoidosis، واحد عنده infections، strep infection، coccidioidomycosis. All of these might present fungal infection with erythema nodosum cancer. So keep these in mind. اللي هي الكوز تبعت erythema nodosa observed by the physician or patient. Papulopustular skin lesions or folliculitis with characteristic acne for nodules observed by the physician. الباثولوجي تيست اللي حكينا عنه. So remember you need to have اللي هو recurrent oral ulcers plus 2 of the other criteria. Treatment for oral and genital ulcer, topical steroids or sacral fate solution are first line. For severe mucocutaneous lesions, systemic corticosteroids, azathioprine, pentoxifillin, dapsone, interferon alpha, colchicine, and thalidomide have demonstrated benefit. In ocular disease, azathioprine is widely accepted as the initial agent. هذا عنده سؤال على البهجة disease because we'll move to familial Mediterranean fever اللي هو also known as recurrent cholecystitis. الفاميليال ميديترينيان فيفر هو من اسمه فاميليال معناته بالفاميليز، ومن اسمه ميديترينيان معناته عندنا بالميديترينيان اريا، وفيفر اللي هو فيفر بيكون عنده المريض فيفر. فيعني من الاسم تبعه you can get 3 characteristics of this disease. طبعا it's very common بالأور area. بتروح مثلا على US rarely they hear about or مش they rarely hear about these، يعني بالpractice they don't see these diseases. فالgeographical area إلها importance. يعني عندنا هون مثلا بس نروح على رحمة، يعني رحمة they are professional بالdiagnosis تبع familial Mediterranean fever. Why? Because they see many patients who have the symptoms of familial Mediterranean fever and they got used to it, the familial Mediterranean fever. But if you go, for example, to a hospital in the United States, they rarely see patients with familial Mediterranean fever. عشان هيك they might miss this diagnosis. Yeah. So it's a prototype of a group of inherited autoinflammatory diseases. So it's inherited hereditary recurrent fever symptoms of syndromes that are characterized by recurrent episodes of fever with severe serosal, synovial, or cutaneous inflammation, and in some individuals, the eventual development of systemic AA amyloidosis, because this is the most serious complications that we are worried about. الميل للفيميل 2 ل1 compared إذا بتذكروا البهجة 3.8 ل1. The frequency depends on ethnicity. It affects people originating from around the Mediterranean Sea. Sephardi Jews, Cypriots, Turkish, Armenians, Italians, Arabs, Middle East, Mediterranean area. Occasional cases are found in absence of non-Mediterranean ancestry. So occasional cases. So you see, so it's almost you have to have a Mediterranean ancestry before so that you have familial Mediterranean fever. The pathophysiology is autoimmune recessive disease, familial Mediterranean fever, but positive familial Mediterranean fever can only be elicited in 50% of cases. The carrier frequencies reach as high as 1 to 3 among affected population. Most patients have only a single demonstrable Middle East fever, V16P13.3 mutation on DNA sequencing. Anyhow, so it's recessively inherited. شو الباثوفيسيولوجي في عندك شيء بسموه familial Mediterranean fever gene. Other encode 781 amino acids, 90 kDa protein, donated pyrene or marinostrine that is expressed as granulocytes, monocytes, dendritic cell synovial, peritoneal fibroblast through a number of mechanisms. Pyrene regulates اللي هو caspase 1 اللي هو interleukin 1 converting enzyme and thereby interleukin 1 secretion. Anyhow, so this familial Mediterranean fever encoded G responsible for البايرين. البايرين بيعمل لك سبريشن للي هو الانفلاماتوري ريسبونس زي الانترليوكين 1. لما بصير في عندك بروبلم بالفاميليال ميديترينيان فيفر بالجين هذا البايرين will not work and ineffective pyrene production بصير في عندك. Will this ineffective pyrene does not inhibit inflammation normally and lead to excessive interleukin 1 production. So this is the whole pathophysiology of familial Mediterranean fever. يعني في عندك جين سموه familial Mediterranean fever gene هذا responsible على production تبع البايرين. البايرين بيعمل لك control للانترليوكين 1 and other inflammatory enzymes. لما بصير في عندك abnormal production للبايرين بصير في it will not work فبصير في عندك يعني widespread inflammation and excessive interleukin 1 production. So this is the whole pathophysiology of familial Mediterranean fever. شو بصير في عندهم تبعين الفاميليال Mediterranean fever من اسمها familial Mediterranean fever. Fever may be the most important one. بصير عندهم acute attacks or paroxysms. Age of onset febrile episodes may begin in early infancy. And تخيل هو عمره سنة الطفل. 90% of patients have first attack by the age of 20. فمعظمهم يعني they are diagnosed بالpediatric age group. The duration generally 1 to 4 days. Arthritic attacks and tend to last longer. Frequency sometimes occur with greater regularity, but more often the frequency varies over time. So في عندك the frequency might be frequent and might not be frequent. Relieving factors will precipitating factors often unpredictable. Some patients relate them to physical exertion, the precipitating factor. Emotional stress, menses, pregnancy may be associated with remission. So pregnancy may be associated with remission. The attacks شو بصير في عندهم fever, nearly always present. Severe hyperpyrexia and febrile seizures may be seen in infants. In 25%, it is the only manifestation, especially in young children. Abdominal attacks in about 90%. يعني الفيفر تقريبا 100%. الابdominal attacks تقريبا 90%. عشان هيك هذول المرضى يعني might end having cholecystectomy or appendectomy because they are misdiagnosed. Acute abdominal pain and signs of peritonitis resembling appendicitis or cholecystitis may lead to unnecessary laboratory or laparotomy and appendectomy. Severity is variable. ليش؟ ما هو واحد جايك فيبر وعنده abdominal pain. You will be worried about acute abdomen. فلما بيكونوش يعني expert وما بيشوفوش مرضى كثير الفيزيشنز بالهوسبيتال اللي بيروحوا على المريض, they might end these patients might end having laparotomy and surgeries. In many cases, patients develop constipation during attack because of the severe inflammation and diarrhea after the acute attack resolves. The CT may show small amount of fluid in the abdominal cavity because of the inflammation observing the oozing the fluid. A sterile neutrophil-rich peritoneal exudate is present. Adhesions and ascites are rare. The chest attacks are chest pain, pruritus in about 25 to 80%. So compared to the fever 100%, compared to abdominal pain in 90%, this is not a common. Usually manifest as unilateral sharp stabbing chest pain that makes it difficult to breathe or lie flat. Picture of is rare. بصير في عندهم بالراديوغرافs may show atelectasis or effusion. شو هو الatelectasis اللي هو الكولابس بالالفيولاي اللي طبعا وين اكثر شيء كومن الatelectasis اللي هو البوست اوبراتيف المرضى اللي بصير في عندهم سيرجريز اللي بيعملوا سيرجريز عشان هيك we use an incentive spirometry for these patients. Thoracentesis demonstrates a neutrophil rich exudate. After repeated attack, pleural thickening may develop. Systematic pericardial disease is rare. طيب الجوينت اتاكس تقريبا نفس الشيء مش كومن. بيصير في عندهم acute arthritis, usually monoarticular. Large stellar neutrophil rich effusions are frequent. Joints are normal between the attacks. Permanent damage is usually a radiographic change and radiographic changes are rare. وممكن يصير في عندهم chronic arthritis before colchicine. طبعا هاي كانت common, now it's rare. Before colchicine prophylaxis, chronic arthritis or of knee or hip were seen 5% in those with arthritis. 10% developed seronegative spondyloarthropathy and chronic sacroiliitis. The most characteristic is erysipelas like erythema هي skin manifestation. وبصير في عندهم ممكن يصير في عندهم اللي هو raised erythematous rash, most common on dorsum of foot, ankle or lower leg. طبعا هذا بصير in about 50% of cases. So it's more common compared to lung manifestation. Biopsy demonstrates perivascular infiltrates and granulocytes and monocytes of granulocytes and monocytes. Myalgia, exercise induced. Myalgia is common. Small percentage develop protracted febrile myalgia lasting several weeks. Scrotal attack in about 5%. بصير في عندك acute scrotum زي acute abdomen طبعا بصير في عندك pain, swelling and pain and swelling affected scrotum زي شو اسمه orchitis والepididyma orchitis. The aseptic meningitis has been reported, but usual connection is controversial. Vasculitis, including congenital purpura, pan والبهجة disease اللي هي البانزل arthritis nodosa. Episodes of pelvic inflammatory disease in female patients may occur. Infertility in about 1/3 of this is an important point. 1/3 of females اللي عندهم familial Mediterranean fever patients are infertile. 20 to 30% of pregnancies result in fetal loss. يعني it's a disaster. واصلا كمان هذول ما بدهم يكونوا ماشيين على اللي هو الcolchicine, which is teratogenic, leads to trisomy, chromosomal trisomies. يعني الfertility it's a disaster. 1/3 of females are infertile. وال 2/3 تقريبا 1/3 of them if they become pregnant will end with fetal loss. In addition to the complications تبعات اللي هو الcolchicine. Excuse me. Before colchicine prophylaxis, systemic amyloidosis was common complications. Common complications, it's caused by deposition of fragment of serum amyloidosis E يعني اللي هي as a result proteinuria adrenal بالintestinal بالkidneys فبصير proteinuria. المهم الكومبليكيشن تبعته اللي ما في to death اللي هي الاميلويدوسيس. هاي قبل الاريا of colchicine. Now it's rare. Amyloidosis should be suspected in patients who have proteinuria. Renal or rectal biopsy is used to establish diagnosis. How do you diagnose renal or rectal biopsy? Risk factors for developing amyloidosis include هذول اللي هو M694V, homozygous, positive family history, SAA1 genotype, male gender, non-compliance with medication, and having grown up in the Middle East. حتى اللي will grow up بالميدل ايست يعني حياته بدها تكون تختلف عن اللي grow up somewhere else. Investigations ممكن lab features during attacks are consistent with acute inflammation and include elevation بالESR, بالwhite blood cells, بالplatelets, acute phase reactants, transient albuminuria and hematuria may be seen. Differential diagnosis. Show differential diagnosis. If a patient is seen during the first attack, differential diagnosis may be broad, narrowed by specific organ involvement. Often, several attacks. Differential diagnosis may include other hereditary fever syndromes, syndrome of periodic fever, porphyria, juvenile rheumatoid arthritis, inflammatory bowel disease, hereditary angioedema, gynecological disorders, infectious inflammatory pelvic inflammatory disease. For typical cases, physicians experienced with familial Mediterranean fever can often make diagnosis. Genetic testing can provide useful adjunct. بس ما فيش داعي انك تعمل genetic testing, so it's a clinical diagnosis. So remember that there is no point doing genetic testing. Genetic testing may be of prognostic value. M694V homozygous have an earlier age of onset and a higher frequency of arthritis, rash, and amyloidosis. The E148Q variant is usually associated with milder disease. So this is an important to remember. E148 associated with milder disease. كل الجيناتيك تيستينج له يعني ملوش علاقة بالمانجمنت ولا أي شيء. بس له علاقة بالprognosis. It's not mandatory. You don't need to do genetic testing. If you suspect that your patient has familial Mediterranean fever and you can make the diagnosis based on your clinical experience, then you are done. This is diagnosis of familial Mediterranean fever. In cases where genetic testing is inconclusive, clinical judgment is very important, and sometimes a therapeutic trial of colchicine may help to confirm the diagnosis. يعني واحد يجاك عنده recurrent abdominal pain ممكن تعطيه colchicine. يعني you are still questioning if your patient has familial Mediterranean fever. You can give him a dose of colchicine and monitor him. If the symptoms will resolve, then mostly this is familial Mediterranean fever. The genetic testing of unaffected individuals is usually inadvisable because of the possibility of non-penetrance. So ما فيش داعي تعمل genetic testing. The treatment attacks are self-limiting, require analgesia and NSAIDs. The treatment of choice is daily colchicine, which decreases attack frequency and intensity and prevents amyloidosis. Colchicine is an alkaloid that may interfere with microtubule formation, thereby affecting mitosis and other microtubule-dependent functions. Colchicine and metabolites are excreted through urinary and biliary tracts. Lethal dose of colchicine 1.2 to 1.8 milligram per day. It causes substantial reduction in symptoms in 2/3 of patients and some improvement in more than 90%. Children may require lower doses, although not proportionately to body weight. Colchicine side effects are bloating. They can be minimized by starting a low dose, splitting the dose. If taken by either parent at time of conception, حتى مع the father, colchicine may cause a small increase in the risk of trisomy 21. Bone marrow suppression. IV colchicine should not be administered to patients taking oral colchicine because of severe fatal toxicity. Cyclosporine inhibits hepatic secretion of colchicine. sometimes leading to colchicine toxicity in patients who have undergone renal transplant for amyloidosis. Other اللي هو neuropathy, rhabdomyolysis, severe toxicity resulting in multi-organ failure, convulsions, coma, and death. All of these are restricted to colchicine. There are no established alternative treatment لل 5 إلى 10% patients who do not respond to colchicine or cannot tolerate therapeutic dosages, although interferon, alpha interleukin-1 receptor antagonists, and tumor necrosis factor inhibitors are investigational. Bone marrow transplantation has been suggested for refractory familial Mediterranean fever, but the risk-benefit ratio is currently regarded as unacceptable. And with the immunosuppression, the prognosis, compliant patients with daily colchicine can expect to have normal lifespan if colchicine is started before proteinuria. Even with amyloidosis, the use of colchicine, dialysis, and renal transplantation should extend patient life beyond the age of 50. Thank you. الله يعطيك العافية. خلينا start a new meeting ونعطيكم محاضرة الجاود. اوكي. على نفس الميتنج اي دي ونفس الباسورد.
تمام دكتور.